Searching for medical advice on the internet can be confusing and just lead to lots of anxiety. So I'm here to answer some of the more complex medical questions that you may have. I'm Dr. Candice Fraser, and I'm a board-certified OB-GYN. Why is it so hard to get pain relief in advance to getting an IUD, and why do some doctors tell you that it will not hurt? I don't know why people say it does not hurt. I usually tell my patients that from my experience, about 50% of my patients at the end of getting an IUD, they say, oh, it wasn't as bad as I thought. 25% were like, kind of what I thought, and 25% was like, oh my gosh, what did you just do to me? That was the worst thing ever. What I usually say is that it's a pretty quick procedure getting an IUD inserted. For most people, it's gonna be a couple minutes. And there's gonna be moments where there's intense cramps and surges that can feel painful. We have done some studies about pain management for IUD insertion, and it's kind of inconsistent about what is the best pain management to administer, before you get an IUD. Most people would agree that taking an anti-inflammatory medication prior to get your IUD 30 minutes to an hour will help somewhat with during, but also definitely with any cramping afterwards. Some people will recommend topical or local medications, so medications that you can just apply with a spray or a gel or a cream on the cervix, or also there are medications that local anesthesia we can inject into the cervix. As far as like a local injection, a lot of times it's decided that, we'll just do the IUD insertion versus having the pain of the injections and then the IUD insertion, because it may not completely take away the pain. Why don't we just put people to sleep? Because there are risks to anesthesia, and so to undergo general anesthesia will take you longer to fall asleep and wake up than to get the IUD inserted, and there are a lot more risks for anesthesia than for a 2-minute procedure. However, sometimes patients who are already undergoing a procedure may opt to get an IUD inserted while they're already under anesthesia, and there are some cases where it may be necessary to undergo general anesthesia. But for most patients, I promise you, most people do pretty well with an IUD insertion. I always recommend eat before you go in. Don't go in hungry. Don't go in, dehydrated. Take some anti-inflammatory medication like ibuprofen before you go in, and you'll likely be fine. For those times when it's the worst thing ever and you feel like we're really, attacking you, just be open to letting us know if you need to take a break, or if you are you're tapping out, this is not for you. That's okay for you to want to discontinue a procedure if it's not, feeling right for you. But the summary is that we don't have consistent data about what is the best thing to do to prevent or reduce the pain during an IUD insertion, so it should be a discussion with your doctor to decide what's best. If you feel like it will be helpful to have something to help your anxiety during the procedure, many doctors will be willing to prescribe you a short-acting medication to help reduce your anxiety before your procedure. So feel free to have that discussion with your doctor. What can I do to make it easier to have an orgasm on SSRIs? This can be a complex question. So SSRIs, which are medications that are commonly used for anxiety and depression, PMDD, and many other things, has been associated with decreased sex drive and also may impact a person's ability to have an orgasm. There are some conflicting data about whether or not this is directly related to the SSRIs, as some people may believe that it may be also due to the underlying condition, which is depression, which can also affect someone's sex drive and their ability to have orgasms. It will be important to assess whether or not the SSRI is working, how well it's working to manage your depression, and also how severely are your orgasms affected. Is it that you're not having an orgasm at all? Is it just less? Is it just more difficult? And so sometimes doctors may recommend reducing the dose of the SSRI and seeing if that is helpful. Sometimes you can add medications to the SSRI that may reduce its impact on sexual function. And sometimes it may be necessary to completely change the medication. I also kind of have a discussion with my patients because sometimes we tend to think that sex drive should look a certain way. But if you're someone that you're not really bothered and you're like, I feel better with this SSRI, I'm cool, my relationship, I'm cool, I'm okay, it doesn't necessarily mean that that's a problem. If it's not a problem for you, it's not a problem for me. We have to weigh the actual impact of things in our life, but it's important to discuss it with your doctor and figure out what the best thing to do. I'm someone who has lost my libido or sex drive. What can I do to get it back? So what can cause a decreased sex drive? There's a few things. It can sometimes be related to medications that we're taking. Sometimes it's related to the relationship or, how we feel in a relationship, what's happening that can also definitely affect our sex drive as well. Sometimes other medical conditions can affect your sex drive. Sometimes being a new mom, having a baby at home and just adjusting to new life can also affect your sex drive. So I think you just moved, you're starting a new job, you were ill, someone else in your family was ill. These are all big life events and stressors that it makes sense that your body is going to prioritize, some other essential functions or what it deems to be other essential functions and may not kind of focus on the sex drive part of it. So that's acceptable. I want you to be able to lean into that and be aware of what's going on. And then think about how can I reduce the stress that I'm undergoing right now. If you have a new baby, that baby needs to be kept alive and fed, and it's not really concerned about what's going on with you and your sex drive. So you may be consumed with that for, many weeks and even many months, and that's okay. I think in those situations, it's important to have a discussion with your partner, prioritize other things, just being close, touch, massages, other things that may, help nurture the relationship while you go through this stressful period in life. I think sometimes if we can identify medications, they may need to be changed or altered. If there are medical problems, those things can be worked on as well to determine why someone has a decreased sex drive. Don't play on, prioritizing your partner and your relationship. And, sometimes we're in a relationship and we haven't had a date night, for 5 years. Sometimes you have to focus on the relationship and do things to kind of, spice things up. And those things can definitely be helpful. In women, there's also good medical data that shows reading erotica novels can be helpful in increasing sex drive. There are some medications that are available for treating low sex drive. So if we cannot think of any other reason, there's no medical conditions, there's no medicine, life is pretty good, but your libido kind of took a dive, we can discuss if a medication may be helpful. There are also sex therapists that you can go to that can help you with more of the lifestyle things and the relationship things and identifying those things that will help you get your libido back. But as always, start with your doctor, have an honest, open discussion. How will I know when I'm emotionally ready to try again after a miscarriage? So after a miscarriage, there are a lot of things that are happening in your body and also mentally and emotionally. It is a very tough time. We have to grieve when things like that happen, and we all process it in different ways. I think getting support from family and friends and maybe even a medical provider, with counseling, things like that, is going to be very helpful. Most people that have a miscarriage go on to have a successful pregnancy later in life. Pretty soon after you've had a normal period, you can definitely try again. Also, you want to discuss with your doctor, depending on the type of miscarriage you had, like molar pregnancies, ectopics, if you were treated with medication, that your doctor may recommend waiting a few months. I think when you are able to kind of accept whatever happens with your next pregnancy, knowing that miscarriages are pretty common. So some people do have, more than one. Being able to be present for another pregnancy, be healthy, do everything that you need to do to support another pregnancy. I think, when you're at that place, then, that might be a sign. And also when you feel like you have the support, to help you through, with whatever happens next, and you're able to manage your stress and you're able to cope. I don't think that there's a time that's too soon or there's a time that's too long, because I think if you had a miscarriage, it may be that you carry that throughout your life. So there's never going to be a point where you're like, oh, when I forget about it, then I'm ready. I think, when you feel like you're able to move forward and be present for your next pregnancy, that's probably a good indication. I hope you enjoyed this video. I just want to remind you that everyone is different, everyone's body is different, so always consult with a medical profession when looking for advice that's relevant to you.